All right. Well, hello, everybody. Today, I am so honored to welcome Dr. Mei Lin, a graduate of Columbia University and Johns Hopkins Medicine, and a board-certified vascular neurosurgeon whose path has taken her far beyond the traditional boundaries of medicine. Dr. Lin bridges the precision of Western science with the wisdom of spirit and nature to help activate true healing. Her journey led her from the operating room into the realms of the metaphysics, psychology, energy healing, trauma recovery, and shamanic spirit medicine. Uncovering the true health requires more than just logic and modern medicine. As a pioneer in neuroaesthetics, she creates immersive tools that help people access their inner truth, emotional balance, and nervous system regulation through nature's beauty and poetic resonance. She is also the founder of True Wellness, where she guides individuals and leaders to reclaim their health, reconnect with their intuition, and align with their soul purpose through her signature medicine all within you approach. In her words, many of us are skilled musicians when it comes to health, but without a conductor, there's no harmony. And Dr. Lin plays that conductor role so beautifully, teaching others how to orchestrate the balance of mind, body, emotions, and spirit in their own lives. And I am so excited to have her, and I can't wait to dive into her story and have her share her wisdom and vision for a new way of healing. So please join me in welcoming Dr. Lin. So
Thank
I was thinking, May, about how we first met and how long it has been. And I always like to think about, a lot of my guests in season one of my podcast were like friends and colleagues and people I've known for a while. So it's kind of nice to reminisce about our history together. So I started thinking, like, when did we meet? I remember exactly which clinic I was in at the time, which that must have been pre-COVID for sure.
hmm
So
hmm
maybe 2018. Does that sound right?
hmm
Something like
Yeah,
that?
something
Okay.
like that. Yeah.
And I just remember thinking, wow, this individual is so amazing, so bright, and so modest and humble. Those were my thoughts when I first met you. And I would kind of, if it's okay, I'd love to just share how we met.
Yeah.
And I think it was a mutual friend and patient of ours that had introduced you to come see me. I don't even know what she said to you. Did she say, come try acupuncture? Or I'm not even sure how she described it, what I did to you at that time.
Yeah, it was she's actually one of my medical device colleagues.
Hmm.
And she just shared how she was actually receiving acupuncture services from you and that it may be something I would be interested in trying out.
Cool. I love it. It was simple, but enough to make you think, wow, maybe I will check it out.
hmm
Yeah. And gosh, so fast forward, I mean, I have seen your journey and your transition to where you are now, which is so incredible. I'd love for you to kind of give us a little bit of background on yourself. Like how did it all start for you in terms of entering into medicine? Did you know from like early childhood that you wanted to be a physician, or was there some influence from family? Just so curious about it.
Yeah, thank you for that question, Dina, and the beautiful introduction. And in the last several years, I've had lots of opportunities to reflect back. And in terms of the path to become a physician, it wasn't that I always knew that was what I wanted to do. I remember in grade school, we learned about Florence Nightingale, and that was
Hmm.
like our historical figure who we wanted to dress up as. And so there's a
Uh-huh.
photo of me um, with like a nursing hat and like a little purse thing. And that was Florence Nightingale was my first initial historical figure inspiration.
I love that.
Yeah. And then
And
I
this, sorry, just to back up, this was in Taiwan. Is that correct?
no,
Or
actually,
was it here?
it was here in the US. We
Hmm.
immigrated when I was 4.
Hmm.
So I was all my education has been or formal education has been in the US system from the beginning of kindergarten.
Hmm.
Mhm. And so I didn't start to think about medicine and being a physician until I have one brother. He's a year and a half older than I am, and he was looking into it. And so that when you talk about family influence, it was more so that, you and I are familiar with the Asian cultural background,
Yeah.
that there's a lot of attention put onto the male. And so my parents had a lot of expectations on my brother,
Hmm.
not so much on me, but I just shouldered those on, because, being a blue collar immigrant family, first generation, throughout our lives, at a young age, our parents would always say, "We sacrificed our lives so that
Right.
you and your brother could have a better life."
Hmm. Hmm.
And so I really took it deeply to heart of, well, I better make it worthwhile for my parents. And
Hmm.
um because they did all of this for me and I want to be able to reciprocate it back. So their expectations for me as a child actually was to be a piano teacher and get married,
Oh.
have kids and things,
Uh-huh.
but they had, created the path for me. But when my brother was looking into medicine and said he wanted to go to become a doctor, and I said, well, I want that too then.
Okay. You're like, well, what about me? I could do that.
Yeah.
I love that. I love how like empowered you were already at a young age.
Yeah, yeah. I that was something that I wasn't so present in my mind until I dived into a lot of my inner work to realize, oh, I was already very much at a young age self-empowering and also very empathetic and empathic, where my parents would always say that I was the easy one to parent because I just internalized that parent within me.
Right, right.
And they didn't really have to tell me what to do, I just knew
Sure.
what needed to be done.
You were self-directed, self-guided.
Yeah.
That's so interesting. And gosh, I mean, as parents, how lucky they were to have a daughter who was so like dialed in, self-motivated. I mean, that's like the dream, right? That is the dream for, and especially in a Chinese family, right? For a daughter to say, you know what? I want to be a doctor too. Like that's just like that's amazing. And I having your brother as kind of a role model too, was he supportive of that decision for you?
Oh, yeah, absolutely. He took on the big brother role of having gone first and then giving me all his
Hmm.
advice and insights as I was applying for college and medical school. And at the time, he gave me advice of which specialties to look into.
Wow.
Neurosurgery was not one of them.
Okay. Well, I mean, neurosurgery sounds like one of the longest paths as a specialist. Is that not true in
It
terms of the
is,
amount
it
of
is.
education you have to go through?
Yeah,
Well,
yeah.
we'll have to dive into that a little bit later. Like, how did you decide what to specialize in? Or
Mhm.
actually, we could talk about that now because there's so many facets of Western medicine and so many specialties, subspecialties even.
Yeah. Well, I would say for each step, it really, when the final decision came around, I realized that I trusted my inner knowing, my heart.
Mm-hmm.
So major life decisions, when it came push to shove, I would choose that. But on a daily day things, smaller decisions, it was actually harder. It was harder to know, like, okay, which way do I go? Um, but I would say that in taking each step and following the breadcrumbs from my soul and the heart's desire, I first went to med school because I was just fascinated by the human body and the brain and awed and wanted to learn more. But in medical school, as I rotated through the different specialties, honestly, Tina, there weren't very many that I felt drawn to.
Really? Okay.
Yeah, and the non-procedural ones, I thought I would end up doing pediatrics, but obviously I didn't. And I realized that I very much liked creating and using my hands.
Mm-hmm. That makes sense.
Yeah. And so then I looked into the surgical specialties and um, you know, when medical school started, my brother gave me an advice. There were the road specialties acronym. It was like radiology, ophthalmology, otolaryngology, anesthesia, dermatology that were the hardest ones to get into because they had the balance, I suppose, the work-life balance. And
Sure.
at
Right.
the
Where you're
time,
not on call yeah,
I
all the time. Yes.
yeah, at the time, like, work-life balance was not anywhere in my consciousness. It was
Sure.
just like, whatever's needed to be of the highest service, that's what I'm
Oh,
gonna do.
I love that. That's an amazing attitude for a physician and like how blessed your patients are to have that type of doctor with that philosophy. I mean, that's
Yeah, thank you. Yeah. Yeah, and I feel like that was a through line too, as just being a child of my parents of, oh, they did that sacrifice. Well, then I'm gonna repay
mm,
whatever is,
right.
whatever I can pour my heart and life into. Um,
So
and
even beyond your parents, like you took it to that next level of like I
yeah,
have to serve community, patients, and as
yeah.
many people as I can.
Yeah, and I truly, truly, at a soul level, know that service, whether it's through healing and thriving, I really honor that as a sacred calling. And um, so, you know, I looked into the one of the road I was specialties that my brother recommended, and I chose otolaryngology ENT. And
Hmm.
started doing research early first year of med school in the summer, had an awesome mentor, got introduced to medical device innovation. I love innovation that speaks to my creative nature and wanting to also provide the best solutions for patients that are the least invasive.
Hmm. Hmm.
And so I was on this path to become an ENT specialist, but then as we're doing rotations in third year, in subspecialties for surgery, I chose plastic surgery and neurosurgery. And I chose neurosurgery because it's like, well, I want to choose something that would be interesting. Not that I was even thinking of becoming a neurosurgeon. It was like,
Hmm.
here's my chance to do something that I won't do ever later. And then lo and behold, I was like,
Oh, so you went into that just thinking, oh, it's just extra education. I'll get exposed to stuff, but I'm
yeah,
not going to specialize in it.
yeah, yeah, yeah.
Okay, okay.
Yeah. So I actually went into neurosurgery quite late in
Mm,
terms of as an applicant,
mm-hmm,
because it is a competitive field, and with any competitive field, medical students are always advised start doing research as early as you can in the beginning of medical school, build that academic pedigree and CV, and that'll make you a good candidate for residency. And um, fortunately, I had really wonderful mentors on the faculty and the resident level who
mm-hmm.
really just took me under their wings within neurosurgery, and one of them is actually a Taiwanese-born female neurosurgeon as well.
Oh,
And she's a dear friend and mentor who really helped supported um, and nurtured my career in neurosurgery.
that's awesome. Mentors, I mean, you just amen for mentors because I think they come into our lives when we need them the most, when we're a little lost, when we're not sure, and then that person appears. And boy, you better take that opportunity to connect with those mentors.
Hmm.
Yeah. I mean, and even as like as adults too, I think having coaches or mentors is so valuable in all the different phases of your life. So
Yes.
that's great that you were introduced to such a impactful mentor at that time in your career where you're like ENT or neurosurgery, right? Right. And so I'm sure she had a big impact on you in terms of why you decided to go into neurosurgery instead.
Yes, because here was someone who she was a trailblazer, a visionary in her
Yeah.
times, right? And that is when we are visionaries and trailblazers and creating and doing something that is not mainstream, is not, normal, common. It is so helpful to have people who are at that forefront leading edge,
Yeah, amazing.
because it takes a lot of belief and commitment and conviction and devotion and all of that stuff
Hmm.
to
Well,
not get
this is kind of a side question, but I'm just curious how it was for you at that time because I can only imagine that there probably weren't that many women in the field.
Mhm.
And like how was that for you and your mentor being in a position where, because for a lot of women, work-life balance is so important. They're already thinking ahead, like when I have kids or when I'm ready to start a family. And truth be told, May currently, and probably in the last 10 years, I'm probably seeing more physicians in my clinic for fertility support with acupuncture and Chinese medicine than I ever have. And so I understand that burnout starts really early, going through just even getting into medical school and then going through medical school and then the extra training that you have to go through. And so I'm just curious, what was that like for you as a woman saying like, okay, neurosurgery may not be ideal, and most women don't want to go into that specialty because it's a long road or a long journey to
Mhm.
study and get the training. So just
Yeah.
curious about that. Yeah.
Oh my gosh, there's so many threads, different paths we can go through just with that question. Um, I'll say that this is where I'm committed to in terms of I am convinced that we as a soul and human being, we're here to evolve and grow our cognitive capacity and our consciousness.
Hmm.
And so the version of me then, it was in a mindset of whatever it takes. I'm going to serve in a self sacrificing way.
Hmm.
So it didn't matter to me. It was like, people, it wasn't just neurosurgery. Then within neurosurgery, then I chose vascular neurosurgery, was that
Hmm.
even more of, oh, you're really not going to have a life.
Yeah. Well, okay, so tell us, for those of us that aren't familiar with Western medicine, terminology in terms of the subspecialties, what to differentiate for vascular neurosurgery, what's the type of care that's provided, or what do you guys specialize in treating?
Yeah. So vascular neurosurgery is essentially a lot of stroke and bleeding in the brain.
Hmm.
So
Hmm.
lots of life and death emergencies,
Oh
being
boy.
on call 24/7, um, a lot. And
Hmm.
so most of my schedule on the attending level would be to be on call for 24/7, at least 7 days straight, if
Wow.
not longer. And so at any moment, I could be out on a in the grocery store or um, sleeping and get called, and I have to drop everything and go in for an emergency.
Wow.
Mhm.
That's yeah, that is a lot of sacrifice. Well, and also just I'm just thinking about like being on pure adrenaline for that whole time you're on call because you're just like waiting at any minute. You're like, right? It's sort of like the firemen in the firehouse too, when they're like on call for any kind of emergency, fire emergency. I kind of liken
Mhm.
it to that. Like, you're just in that fight or flight mode for that
Mhm.
whole time that you're on call. That sounds really stressful, May, to be honest. Like I can't even imagine. And how long did you do that for?
I was reflecting on this recently actually of we started taking call in medical school. So
Mhm.
from medical school to when I decided to retire last year, I was over 20 years of having a life where I needed to be on call, beck and call for any patient service emergency.
20 years. So it looks like you started at like 5. 'Cause I just think 20 years, you were like 5 when you started medical school. But that is a long time. That's 2 decades.
Mhm.
And yeah, I mean, I can't even imagine like for you and other physicians in your position what it does to the nervous system, like and your adrenals and just everything. And how do you maintain balance and your health and, not have other complications like, well, first thing that comes to mind is insomnia, right? Because you're constantly waiting for someone to call you.
Mm-hmm.
So, or do you just adapt? Does your body just become, no, okay.
Mm-mm. No, I mean, for me, my sleep at that time, I was a light sleeper. And so if
Hmm.
someone woke me up in the middle of the night, the most annoying thing actually to be fully transparent would be if it was a phone call that was not an emergency,
Uh-huh. Yes. Right.
because then it would be sometimes I wouldn't be able to fall back to sleep and I'd be
Hmm.
up for the rest of the night.
Right,
Um,
right. Well, and I can't imagine too, like if it is an emergency, you're called, you have to go into surgery right away. So
mm,
it's like your brain and your mind is not allowed to fully go to sleep
mm,
because it's prepared for like at any minute you need to be super alert and
mhm,
perform a surgery, right? Like
mm,
that's a lot of pressure,
mm,
really.
mhm. Yeah, I didn't think of that.
Right? I mean, so, but I am like so excited for this new journey or this new phase for you, May, for you to be able to, now that you've retired, and I guess I should back up and ask you, at what point did you decide or did you know that it was time for you to retire?
Well, there were really transparently what my first attending job and like being fully in this way of life as a neurosurgeon, I already knew like this is actually not the best way protocol. I knew it was not healthy for me.
Hmm.
And so that when I was in that job, that was how we met. And
Hmm.
when we
Hmm.
met, I was just in the beginning of for my own personal commitment of there's got to be a better way.
Sure.
And shortly after we met, I decided to um, leave the position that I was in because, and at the time, I did consider uh, already leaving the medical practice as it was because of this whole imbalance
Hmm.
of s truly like a full self-sacrifice service. And some people would say, "Well, you didn't have to like self-sacrifice that way."
Right,
It's
right.
true.
Hmm.
But for me, it was I care so deeply
Yeah.
about what I do
Hmm.
because the other person matters to me as much as it's
Definitely.
me. And
Well, you weren't going into your practice like doing anything halfway.
no,
I mean, right? Like you're like, I'm committed, I'm full in, and I'm like 120%. Or why would
Mhm.
I even be here?
Yeah,
And
yeah.
that's, I mean, to be a patient of you, they're very lucky to have a surgeon like you because I don't know if every provider would do that or feels that way. But yeah, I could see where it's like all or nothing. You're like, if I can't do the 120%, I should just retire it and pull myself out. I can't do halfway. I can't do 50%. I can see that, May, being a
Yeah,
struggle for sure.
yeah,
Yeah.
yeah. Yeah, and so I did, do my due diligence and listen to the different advice that was being given, and
Yeah.
so many people said, "You have a special gift to be able to serve in this way."
Hmm.
And so I had, again, a personal commitment and then prayers out to the universe of, okay, this is truly a gift that I am here to serve in this way. Guide me, show me how this can be done in a healthy way that is not only good for the patients in the community that I'm serving, but that's also good and healthy for me so that it's a win-win for
Yes.
all involved.
Right.
And so then that ended up leading me into I say it was my neurosurgery 2.0 chapter.
Okay. I like that.
Yeah. And in that Neurosurgery 2.0 chapter, it was also where I was simultaneously then my second full-time job was I felt like I was like a undercover scientist in the
Hmm.
spiritual energy world, like trying to study for myself, just for myself of like,
Yeah.
what does this all mean? Is it really real? Or is it all just pseudoscience and woo-woo and like hoax stuff? Because there is a lot of that, not as much now, but there is still a lot of that stigma. Um, so I really just wanted to study it for myself and see how can I learn this and suspend any preconceived notions and just give it the benefit of doubt.
So how long did it take you to study all of this as you were doing it like on the down low, part-time, probably between surgeries? Like, I'm just curious because, I feel like we can study things for many, many years and lifelong studying. But at what point did you feel like, okay, I'm satisfied, I have received enough information and, a digestible amount where I feel like I understand the metaphysics now and the spirituality of things and how can I integrate the knowledge that I have as a Western medical doctor and then, with all of the this other stuff that I'm getting introduced to in my 2.0 version. So I'm just curious, like how long did that take you, or at what point were you feeling like, okay, I feel like I have enough knowledge where I can integrate the two?
Mhm. Yeah, I'll see that there were some defining moments. One early defining moment was so you are the one who actually first introduced me to Reiki.
Mm-hmm. Mm-hmm.
And I did learn Reiki just as right before COVID hit. And yeah, I firmly believe everything is all divinely guided and in perfect timing for what we need
Yes.
and what we chose to come here to fulfill as our mission. And I share this because so one experiment that I did for myself was um a Reiki practitioner had just suggested to me, we can send Reiki to anything. We could send it to the work situation. We could send it to a place. We could send it to, as you know, it could be anything.
Mm-hmm.
And so I experimented with sending Reiki to my on-call work weeks.
I love it.
Yeah. Because as you can imagine, my work weeks would be huge roller coasters and very, very high intensity and um when dealing with life and death and then needing to essentially be the commander of a ship going through the storm
Yeah.
and navigating challenges of that, not just only inpatient care, but then as you had alluded to earlier in our conversation, as you know an Asian woman who doesn't look like a stereotypical um image of what society displays as a neurosurgeon. And so I had lots of relationships that were more conflicting rather than easeful communications.
Mm-hmm.
And so I started to send on my weeks off, and it didn't take long, just 3 minutes or 5 minutes. I would send Reiki to the week ahead.
I love that.
Yeah.
And what kind of Reiki message would you send?
I connected with all the brothers and sisters of the light, to the highest guides, the angels, all the helpers, the ancestors, and send Reiki to the work week that I can start to feel some tears come up.
Mm, yeah. Thanks for sharing me. I know it's still like it wasn't that long ago, and even though you've stepped into this new phase, it's still, we still hold a lot of it within us. And I mean, I'm just so grateful that you were able to find Reiki and apply it to help you get through some hard times.
Yeah. And you asked me what I asked for. It actually wasn't for me. It was that we would have all the resources that are available for the best care of the patients.
Oh, so you were sending it for the patients. So even at that point, you were, of course I want to use that Taiwanese word that we always talk about, yuhao, right? But it's
Yeah.
it's self-sacrificing, I guess would be the best translation. You were already like, what, instead of asking for make my work week smooth and please don't have me called out too much. Like I feel like that's what the average person would probably have asked for and
Mm-hmm.
use the Reiki for. But here you're coming from this space of like love and so much deep care for your patients, and you don't even know who these patients are going to be,
Mm-hmm.
but you're already sending out the positive intention and that love for the patients, which is amazing. That's so incredible, May. I mean, for a provider at your level to do something like that is just unheard of. I'm just going to say that. I mean, I don't, that's just so sweet and so kind. I was waiting for you to tell me. I was sending Reiki to say, please don't put me on call or don't call me like more than 2 or 3 times, like a set amount of times. But so,
Tina,
so,
I
mhm.
had those prayers too of please allow me to be able to sleep through the night so that I can
Yeah,
be fully resourced to take care of the patients who need
for
immediate
sure.
care. Yeah.
Yeah. So you can show up as the best version of yourself as a
Yeah.
surgeon to be able to do your work.
Hmm. But we were dealing with, I mean, and it's not atypical. We would, in COVID times and still out of COVID times, the challenges of the healthcare system with having
Mhm.
resources and having it be profitable and then really boots on the ground. I was in a facility where the MRI machine and the CT scan machine every couple weeks or every week we would get notifications that machine's down and
Oh.
nursing shortages or whatever shortages and it's like how can we really be in the best service of patients with all of this going on?
Hmm. Hmm. So that was part of your Reiki intention, right? May things
Mhm.
be smooth. May all the resources be there so that patients can receive the best care
Mhm.
possible to help them heal.
Yeah.
And how did it work?
Magically, Tina, I mean, within 6 months, my work week started to be less chaotic.
Wow.
So, like, it did, and again, it wasn't like I was meditating 30 minutes a day.
Yeah.
It was just the intention once a week, the week beforehand, at least a few minutes, connecting with Reiki, sending this out, trusting that there's the higher powers at play who are providing us assistance and aligning me with my intentions. And my intentions were, even though I did share the first request was that all the resources are needed for the patients, I did request that it also be healthy for me.
Mm-hmm.
And so within 6 months, like my week started to settle out, less chaotic and even less conversations with, challenging dynamics.
Mm-hmm.
And
Hmm.
um so my retirement from the practice wasn't out of like, frustration of like this is too chaotic, like what's going on. It
Hmm.
was it was a conscious intentional of being able to see what is now being asked of me how I serve is transitioning. I no longer need to serve in this way.
Sure.
Um, and that's how we evolve. We're here to grow and evolve and shift what we do in our life. And I would summarize that the this neurosurgery chapter, not all of it, a good part of it was very much in the you named it, the survival type consciousness of and it is like dealing with life and death.
Mm-hmm.
And so very much steeped, whole being, consciousness, energy, way of life. And then my medicine now that I can guide people on is how do we transition out of that survival mode into not just healing, but then a thriving mode? Because a lot of people can also get stuck in
Oh yeah, for
a
sure.
healing loop and
Mhm,
not actually be able to thrive.
mhm. Well, and I think that if you get into this pattern, you just think like this is the only way. Like this
Mhm.
is the only way I know how to live, I guess. Like, is there even options? Like, is there a different way to live my life?
Mhm.
And I think when you're sort of on autopilot,
Mhm.
that happens, and you're not there, the awareness actually isn't even there
Mhm.
because you're just kind of like cruising on cruise control. And it's kind of sad because there could be so much more potential for you to fulfill, some of the things that you enjoy, or maybe you find things that you actually enjoy that you didn't even know about, right?
Yeah.
And so like the untapped and unseen gifts that you may have to share with the world, and I think like it's so cool that you went on that journey and you looked and you took a really deep dive into it
Mhm.
to kind of see like, okay, how, is this number one for real, which I love, like totally coming from like a science mind, right? And then being able to actually apply it into your practice, like, and
Mhm.
seeing the effects of it. I'm sure you were just like the first week you were probably like, nah, that's just a coincidence. That couldn't be. And then as you started to see the pattern, like, well, wait a minute. And yeah. So after the Reiki, for your Reiki training and your experiences with Reiki, what was next for you? Because I know that you've done some shamanic training and so much more than that. So how
Yeah.
did you know what was going to come next?
So what I'll say that to tie this in with your earlier question of how did I know I have received enough wisdom to apply it,
Mhm.
is that I found the defining difference was being able to really take a radical responsibility to see what was showing up in my life as that is message for me of I'm bringing this in to heal, shift, and transform. And so it was bringing what was in the subconscious into my conscious awareness and realizing that whatever was showing up in my reality um, was a reflection of what's in my subconscious. So
Mhm.
if I was having a difficult conversation, relationship with someone, a dynamic, that there was something that I was bringing that into my life
Mhm.
that I needed to look at it and see, what underlying subconscious limiting beliefs were there. Um, and a major part then was this whole process of how do we manage our emotions
Mhm.
and in western medicine system and very much within neurosurgery. So neurosurgery was created by it's majority men and it was started by military men. And so there is
Mhm.
a lot of that consciousness of um we need to be the strong one. You can't show any emotions because the patients and everybody else on the team are looking up to you as the one who's the leader, who's strong and knows. So if you start to show any emotions, that's a sign of weakness,
Mm.
and then they won't trust you.
Mhm.
And so, you know, I learned that protocol, and I found that a lot of times in my life, as you have mentioned, it is like I am immersed and steeped in it to learn it fully and then learn where it hits a capacity, a ceiling effect, and realize like, okay, it's served it until this point, and then now we need to learn another way.
Sure. Right.
And so when I looked into the whole part of how do I learn to become aware of suppressed emotions, and a lot of those suppressed emotions are stored in the subconscious, and they're also leading to self-sabotaging
Hmm.
behaviors. And,
Right.
um, and so as I started to excavate, doing, I say, brain surgery on myself,
Hmm. Yes, very appropriate analogy. Hmm.
and that's how I became aware of having a huge energetic wall around my heart. Um, And so as I chipped that away and opened up my heart and opened up my sensitivities, and that opened up the pathway of being able to reconnect with my subtle senses and reconnect with my empathic abilities in a conscious, healthy way, is
Hmm.
realizing that and I would say it's not just unique to me. I am convinced that our human bodies are wired for sensitivity. Um, it's just we haven't been taught consistently in our education how do we honor these sensitivities as tools and skills that are in service to us in our lives.
Hmm.
So when it's um, and yeah, so that I found as I started to learn emotional management, sovereignty, and um, seeing them actually as powerful information that is actually asking for me to continuously bring my life into congruence.
Hmm.
Um, then I started to also have just knowings and rememberings um, of some shamanic practices, and something that I was still in clinical practice at the time, and one thing that was very apparent of in the shamanic field. You talk about there are people who are seers and knowers who can just sense what's ahead,
Hmm.
and I realized that that was in my uh, practice of patient care, where my physician assistant and nurse practitioners very frequently, I would be reviewing patient um, conditions and lab work and CT scans and all that. And I would just get a sense of, oh, can you go check on this thing on this patient? And they would go and they would come back and say, how did you know that was going to happen?
Yeah.
And
Yeah.
I, so
And I'm sure that your intuition and your inner knowing was serving you very well in medicine. And maybe you weren't quite aware of that there was that inner intuition that was guiding, some of the decisions you were making in practice. But
yeah. So now that I reflect back, you're absolutely right, Tina, is I realized that my intuition and inner knowing was serving for the patients, but I
hmm.
didn't know how to use it to be of service for me. Like, I
Oh,
only knew
yeah.
how to use it for other people.
Sure. Oh, for sure. Yeah, well, and I think that, and I think you are considered an empath. And I think as an empath, that's very common,
Mhm,
right? For us to use, apply the intuition and apply our tools for everybody else and not
mhm,
really think about ourselves and how
mhm,
it might actually be an advantage for us too. Um, but I think it's uh it's a learning process for empaths to be like, oh, maybe it'll be helpful for me too, even though
yeah.
I've been doing this for 10, 15, 20 years. Maybe I need to self-apply this. And yeah.
Mhm. Yeah, you're right, Tina, and I just completed this whole year-long intensive shamanic training, and what I found so helpful and critical that I then impart with the work that I do now of this um, energetic enmeshment and knowing what is actually mine and not mine. And
Mhm.
so when you talk about being empaths, there's a whole process of like this whole energetic enmeshment. I really had to dissect out very meticulously of what is mine and what is not mine.
Yes, I know. It's hard to tell because it is really like tangled
Mhm.
tightly.
Yeah, well, but it absolutely. is necessary and can be done, because when
Mm,
we are able to have that clear boundary and separation, um, I have found it in my life. I'm so much more uh, empowered and calm and resilient of uh to me it's like a superpower of I'm so clear on who I am, what my intentions are, what my values are, what I'm doing. And so it's like having I am a solid sounding board. So whoever
mhm.
comes into my life,
Yeah.
um I can have a clear understanding of where that other person's at.
Yes. That's amazing. Yeah. And being able to be a supportive rock for that person or
Mhm.
whoever you're working with. Well, gosh, I have all these questions prepared for you, and I think we have touched on a lot of it. But I do want to ask you about the approach that you created, this medicine all within you, and what are some of the key like pillars about it? And would you be able to share a little bit about medicine all within you?
Yeah. So there's so key pillars are, as the name suggests, the
Hmm.
medicine is within each individual. And the reason for really honing this in is that we also have created a society and services that um, are programming and training people to seek outside of themselves.
Yes.
And and I realize that I have been practicing medicine all within you even before this new way of serving. And how I did that was with my patients. I had always taken on a role of my job is to distill all my learnings and knowledge about this expert thing in a way that my patient and their family can understand in this short amount of time period so that they can make the decision that is correct and right for them. And what I would say to them is, I don't live in your body 24/7. I don't know your values intimately like you do. And so, if a surgery is elective, I'm not the best person to tell you do surgery or not. My job is only to provide you with all the information in a way that is understandable and digestible for you so that you can make the empowered decision. Because at the end of the day, it's the patient and the family who have to go through this surgery and do their recovery.
Mhm.
I'm not the one who's there receiving on that end.
Right, right.
And so it's really the intention is giving the power back to the people to know how much control and power and agency people have.
Hmm.
And then on the next level is that we talk about the higher power and the source, and in that connecting with the medicine within is the way we connect with our intuition, and that's also our guide, our how we receive information from our higher power, whether people want to call it God or nature or universe
Hmm.
or Allah or whatever people resonate with as that higher power. um, our bodies and our brains are designed to be receivers and transmitters of this information.
Hmm. So, how would you recommend a patient that's navigating the traditional Western medical model, and they're getting all this advice from experts and they're being told, you need to do this procedure and, if you don't do this, these are all the repercussions. There's like a fear factor involved a lot of times
Yep.
with very chronic
Yeah.
critical conditions. And I think that fear factor is strong. And
Mhm.
so families and patients can quickly jump into procedures that may not necessarily be needed. So, what advice do you give patients and clients, like how to navigate a model that's like that?
I know, that's
Because it's not really conducive for, okay, I mean, if all physicians were like you, that would be amazing. But it's really not like that right now. And, how do they like, okay, let me stop and not let that fear factor um, lead me down this rabbit hole and I don't want to make a rash decision because of that, and
Yeah.
I want to have that time to reflect within what's best for me or my parent or my loved one that's going to serve their highest good and have the best outcome for them.
Yeah. I love that question, Tina. I mean, that is part of the mission of empowering the individual themselves and with these services of and simply it is feeling into, is this recommendation empowering or disempowering? And so
Hmm.
feeling in the body, do you feel deflated or do you
Hmm.
feel energized?
Hmm.
And there can be so many factors contributing to that sense of being energized or being deflated, um, and and this can also sound cliche then, is that when we have the choice of do we go down the fear path or do we go down the love path? And so what I have learned is consistently is it's not cliche, it's my own lived practice of when I choose fear, um, there it tends to be then associated with struggle and conflict
Right.
and
Yeah.
challenges
Hmm.
and we're also taught to just push through no matter what. So
Right.
that's where it gets into how we talked about like needing to dissect and tease out what is true and what is not true.
Hmm.
And so I feel like I would be out of alignment if I'm recommending people, "You need to do this, 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 and this, and this."
Yeah, and I think because I oftentimes think about when my parents were sick and ill, and as the children, we're making a lot of the decisions
Mhm.
for your parents, especially if they're not conscious, like in a stroke situation, like
Yeah,
my dad had.
yeah,
Um, but at the same time, if they are conscious and your parents are aware, and they still have their facilities intact. I think the older generation is very much about whatever the Western medical model says I'm supposed to do, I will do. It's like I have to follow all directions of every one of my providers. They're the
yeah.
experts. There's such a um, I felt like with my mom, for example, she was so unaware. Like she was so not in tune with herself. She let the external forces make all the decisions for her, which was not always the healthiest option for her. And so I'm just wondering, like in situations like that, where you're sort of making decisions for a loved one, and the loved one perhaps is in that sort of older model, I'm going to say, of thinking.
Mhm.
How do you navigate that? How do you advise those families to move forward and really kind of apply the medicine all within you approach?
Yeah, that's such a complex, nuanced question and answer, Tina, and I'll share, my own parents. I have my own experiences with what you described, and, I say that as family members, there is a point where there is only so much we can do.
Hmm.
Because at a soul level as well,
Sure.
that it is a choice, and so that is what I have learned for myself of I can do my best to provide education and resources and guidance and skills. At the end of the day, it is the person who has to choose to commit and learn and you know, want to explore and see how they can live the medicine within them.
Right.
And so there is the part where I have through for myself through the shamanic training and other personal inner work that I've done of seeing where the part in me has to be the savior. And it's needing to tease out that savior mentality and
Mhm,
trust that,
mhm,
this is the best. And I also do see that um, I have the other lens too of giving people the benefit of doubt,
mhm.
meaning that if they haven't done it yet, have they been given all the resources that are available and then they're choosing not to?
Sure.
So that's
And
different.
it's still their right to choose that.
Yeah.
Yeah,
But
that
if they
path.
haven't been exposed to those resources and tools, well, then let's provide them with the resources and tools. And it's no longer about knowledge either, Tina, because knowledge is available anywhere through
Mhm.
Google, ChatGPT.
Oh, yeah.
So it's not about knowledge, it's about
Sure.
actually putting it into practice.
Mhm,
And the only person who can put it into practice is the individual themselves.
mhm. Well, and really tapping in and quieting themselves to listen, like, what is it that I really want for
Mhm,
myself?
mhm,
And is this procedure or is being on all these medications what I really want? And
mhm,
sometimes it is.
mhm. Yeah, and
And
also knowing that that can change. It may be what it is needed now.
mhm,
Doesn't mean that they need to be on this medication for the whole life,
mhm,
because we
mhm.
are continuously growing and evolving and shifting. So
Yeah.
what just I look at my life. I mean, neurosurgery absolutely was what I needed to do, but it's not what I need to do now. Just
Mhm.
from your question, I'm like, yes, this is why I needed to retire so that
You have this other calling.
so that people like what you described who are in that older paradigm of you have to listen to the expert. Well, then now here is this person who has been deemed an expert by society telling you, listen to your intuition.
Yeah.
You know the answer. And if you don't know the answer, work with someone who's going to help you connect with your own answer, not
Mhm.
someone who's going to tell you this is the answer.
Right, right. I love this. It's so like unconventional, which in a good way. Like I love it so much because I think having your background and your perspective and being able to tell patients like, no, actually, you got to look within and give yourself some credit that you know what's best for yourself, and it's okay to take all the advice and the resources and poll everybody what everybody thinks, but ultimately it's coming from within you. So in this in this approach, this medicine all within you, is the mission not to only help patients, but also to help providers too?
Absolutely. Because to me, I've always had this lens. I really have my soul. The way I approach things is it's non-hierarchical. Um, because at a soul level, there is no hierarchy.
Hmm.
We have a society that puts people on multiple levels of hierarchy based on finances and
Hmm.
then expertise and but when it comes to health, health is not hierarchical.
Very true. Yeah.
Someone can be you could be a leading politician, a celebrity, and or you could be the billion dollar whoever, but at a health level, everyone's the same.
Yeah, that's absolutely true.
Yeah, and then the other reason for really connecting with the medicine within is as we to tie this into it on a spirit level, I truly believe, I'm convinced is our spirit is what is animating and providing us energy and vitality.
Hmm.
And it is also where the realm of miracles and possibilities are. Because if you're looking out to experts, experts were trained to look at, okay, what is the evidence base, right? Which is based on average and what can be expected.
Hmm.
But on a soul level And on the level of miracles, those are in the realm of unexpected.
You just said one of my favorite things right there is on a miracle level, because that there are always outliers
Yeah.
outside of the average or the median or right? So, I mean, there's so many I always look for the outliers. And when I
Yeah.
think about the work that I do too with my patients, we're looking for like let's be the exception to the rule, and specifically like for fertility, for example, you're given all this bad news once you're like 42 and up, right? And like, oh, your egg reserves decline so much, the chances of you getting pregnant is this percent, so you're given all this data, which is based on evidence-based
Mhm.
research and collection of data, but there are always the miracles and the outliers. And I'm sure same with the neurosurgery work that you did in those stroke patients. Like, I'm sure you have seen things where patients have like surpassed, what you guys thought would be possible for them.
Yeah, and I reflected on that. What was the difference between these two people who have similar age, um, conditions, and all those other factors, and what's the difference between one who survives and one who doesn't?
Hmm.
It's the spirit.
Yeah, that makes sense.
And on a spirit level, we're all extraordinary. There is
Hmm.
no average on a spirit level where everyone is the outlier extraordinary
Yeah,
and
and a miracle.
in a miracle.
Hmm.
And then on the quantum physics level, it in an infinite field of possibilities. So that's also what I would advise and recommend to that question you asked about the patients is find someone who's going to believe and not just believe, but then work with you on, okay, how, if this is truly what you know to be in service of you and your health, then who's going to support that?
Hmm.
And it's not going to be like easy, you know?
Finding your team or finding your village to support you
Yeah.
through something that might, a process of care that might be a little bit less traditional.
Mhm.
Yeah, I love that. Wow, that was just, I just love that piece about how we're all miracles and we're all outliers. And we need to be reminded of that.
Yeah, I mean, especially with, there is a a collective uh conversation about challenges globally, and to me, I see that as we're being asked to think creatively. And in order to think creatively, each one of us has the unique medicine within them, the unique genius that is going to be inspired by the higher powers to think outside of the box, find win-win solutions for all, and be able to um, shift where we are in the global circumstances that we're in now.
Mhm. If you were to give people advice on how to access this unique genius within, what type of advice would you give these folks to gain more access or how to even start that process?
Hmm. Yeah, I am a firm believer in the power of nature,
Hmm.
and being in nature is a place. So there are scientific studies how being in a state of awe, whether it's through the easiest way to be in a state of awe is to be out in nature, whether it's
Hmm.
the mountains or the oceans, but to be in this state of awe or looking at the stars,
Yeah.
being in this state of awe activates then that feeling of inspiration and then
Hmm.
to cultivate creativity and imagination. And that was something that I really needed to devote into learning this skill again because as you can imagine, with my academic training, it was a lot of memorization and this is the way you do it. And so that creative part of my being was undernourished and underdeveloped.
Hmm.
And it is through the creativity and the imagination that allows us to connect with our intuition and to receive guidance from the higher power too.
Yes, I love that.
Look at the
Ex
musicians. I mean, that's how
Yeah, right. Be in a state of awe. Put yourself in a position where you are wowed by your environment. And yes, the creativity and the inspiration comes. I love that. I think we're staying indoors too much. I think we all need to go out for more walks and even, finding pockets of nature that are close by.
that's why I'm sitting outside, so at
I know.
least
I
I
love
can
your
do my
background. It's
part.
so beautiful. It almost looks fake. It's so, so pretty in Sedona. So, any other advice that you would give to listeners? I know you have an upcoming event. Would love for you to talk about that a little bit more too, and how patients can learn more about, tapping into their just their uniqueness and the miracles that they have within themselves. Can you tell us a little bit about your upcoming event in October?
Yeah. This upcoming event in October, as I was in the creative phases of what do I want to provide as a free gift to the world based on everything that I've learned in medical sciences and then in spirituality and how for me now, I don't see them as different in duality. I do see that they are just on a spectrum and they're integrated and harmonized. And what's most when I look at the science and the spirit of transformation, the best way is through experiences
Hmm.
and experiences that create safety and connection. Because from a neurosurgical standpoint, if I'm clipping an aneurysm, I can't just go right in and clip an aneurysm. There's so much that needs to be done to create safety in order to then go in and deliver the treatment.
Hmm.
And so there are, when we talk about things that are stored in our subconscious and things that are, wounds, inner wounds that we haven't fully healed or are afraid to look into, a lot of therapeutic and coaching services don't actually spend a lot of time in creating that safety element first. I've what I have found, a lot of them, they just want to go right in and deliver that therapy,
Hmm. Hmm.
which then, you know, it actually doesn't work.
Hmm.
So there, the reason I bring this up is the experience is over the 6 days we are creating and transforming the inner world for it to be a safe, sacred space for each individual. And this inner world is the one place we all have control over, um, and have the full responsibility to be sure that it's a healthy, clean, sacred space. And so that is what came alive for me of what can I gift to the world that I feel would be a foundational piece? So it's
Hmm.
this inner prescription, and that this
Hmm.
inner prescription is upstream of mental health recommendations. Um, so I'm so excited I'm so excited to be offering this and to have you be one of our speakers
Oh,
is
yes. And I love that whole concept of creating a safe space within yourself and being able to tap back into that, that sacred place for yourself, and I think that's that's huge. I think that's going to be so amazing for people that are going to join us for this upcoming workshop. It's not even just one workshop. I should call it more like a extended workshop, right?
yeah,
So
the
so how
exact
many
word,
how many
yeah,
days is it for me? Let's
6
talk about that.
yeah. It's a 6-day immersion. We take a break for the weekend, so it
Hmm.
starts on Tuesday, October 14th. So we go for Tuesday, Wednesday, Thursday, Friday, take the break for the weekend, and then resume the following Monday, Tuesday. So
Wonderful.
each day is an immersion into these different important pieces of cleaning up the inner world for it to be a sanctuary and a sacred space.
Hmm. And your lineup of speakers looks so interesting. Can you tell us a little, can you touch a little bit about on the speakers that you have joining?
Yeah. Well, again, in this creative process of what would I love to showcase and allow the participants to be able to experience. And it is the medicine within each person, it is unique and different. And
Hmm.
so that's why I felt a calling to have a whole spectrum. So as when the audience will be able to see there, it's not a heavily weighted spiritual program. It is whoever I know directly or was connected to me through my network of living the medicine within them to then create their own unique path and following that medicine within them. And so you're one of them, and I'm so excited for our attendees in the event to be able to hear how in your experience you have leaned into following that inner truth within.
Thank you, May. I'm so honored to be a part of this workshop and this immersion program. So excited, and I want to be able to join for the whole thing and hear all the other speakers. Can I ask, is this something that'll also be recorded and re-released too for those that can't show up, like for some of the days?
Yeah, absolutely. So during the event itself will be recorded. There's
Hmm.
morning sessions for an hour and then afternoon sessions. So both of these sessions will be recorded. And
Hmm.
then the recordings will be available for at least a week after the event.
Nice. That's
Yeah,
perfect.
so there's not a way to, have a schedule be able to cover everyone's
Right,
ability. So
right, exactly.
fortunately, with technology, we can record and allow people to be able to access it when they have availability if they cannot make it live.
Yes. Okay, that's perfect. So I will include all of that information in the show notes and also the flyer for them for all the listeners to be able to join us. But any other last words of wisdom you'd like to share?
I am just so passionate for people to really connect with the medicine within them because everyone has a unique gift, and we need everyone's unique gift to come online. It's everyone is a unique puzzle piece to the grand cosmic plan.
Yes.
And it is truly, I there's one line or maybe more than one line, but there's a message that I want to impart for people. And in all my years as a neurosurgeon saving lives, and I've been in many conversations with families on goals of care.
Hmm.
And what I've found is that families of patients, the patients who really have lived their life and followed their dreams, and because their dreams are inspired, right? And so the ones who really have followed that path, the end of life goals of care conversations are really easy
Hmm.
because they fully live their life.
Right.
That really to me is the best way to save a life. Why I As my other message now, I'm pouring in my heart and energy to let's let's help you do what it needs to do, whatever needs to happen so that a life can be oriented towards bringing dreams into reality. And it's not some, woo woo, ungrounded, wishful thinking way. It really is. Dreams are inspired, and inspired is being in spirit. And if our spirit is animating our vitality and energy, that's true abundance and longevity.
Yes. And
It's
that's how
not,
we should all be living.
yeah,
Yes.
it's not the monetary and finances are they flow from there. It's not the
Mhm.
other way around.
100%. Thank you for saying that.
Yeah.
Well, May, I can't thank you enough for being on my podcast. And it's so wonderful to reconnect again. And I'm looking forward to the conversations to continue during this wonderful Medicine All Within You workshop that's coming up. And yeah, I will make sure to share all of your handles. Is social media the best way for people to reach you, like Instagram? Is that
Really, honestly, Tina, the best way for people to reach me is to be in the immersion and be then welcomed into this community
okay?
through my newsletters and whatnot. Because here is another saying to me, I'm still learning social media and I'm not quite sure that's where
Same.
it's, yeah, I honestly, I jury is still out for me on whether
Okay.
that is the best place for me to put my time and energy. And here's why. Um, I am very much about depth, quality, and excellence and really connecting with people. And I just haven't found an organic way for me to be able to connect with people at the level of depth and authenticity that is true for me through social media. And so this is, the event itself is a gift from my heart that then people can be within the true wealthness community and be able to connect in that way. To me, it translates from my world as a surgeon and in academics too, is we have a saying where in academic neurosurgery, uh, or at least with my own colleagues that I had been steeped in with, the ones who are writing and publishing about surgery aren't always the ones who are actually in the trenches doing the
Yes.
surgeries. Because if we're doing the surgeries, it takes up the entirety of our day.
Right.
So
Right. Doesn't leave you much time to do anything else.
yeah. So for
Mhm.
me, when it push comes to shove, I will always choose, let me just connect with a person
Mhm.
one-on-one with the
Mhm.
group. If there is extra time to then share, publish a paper or share on social media, I'll do that. But um, the way I
It's not
triage
your first step,
clarity,
right? Yeah. Yes. Yes, I completely get that. And I really appreciate you sharing that, May, because I think we have very similar thoughts on social media. So, website, joining your newsletter, that sounds like the perfect way to connect with you.
mhm, mhm.
Yeah.
Yeah,
Okay. And the immersion, the workshop. Yeah.
yes,
Okay.
yes. Yeah, I'm so excited for the immersion because
Me
it really
too.
is,
Me too.
yeah,
Okay, it will be here before we know it.
yes.
So thank you again, May, for your time. I really appreciate and just love all the work that you do for our community. So thank you
Thank
so,
you,
so much
Tina.
for sharing your gifts and your miracles.
Thank you, thank you.
Thank you, May. I'll talk to you soon. Thanks.